headaches, but if you're anxious, there's a way to find anxiety as a sensation in the body. I always get it right in here or in here, to just open up and feel into what we call pain, but is the location of the anxiety.
Okay?
Yeah, and audience, in case you're wondering what Dr. Femi was referring to, he has a couple books out with Jim Robbins. One book is The Open Focus Brain, with Jim Robbins as a co-author, and the other book is Dissolving Pain. They're both bestsellers on Amazon. Here's a question for you. I've asked you this question before. Normally, you and Susan talk about stress, anxiety, and chronic pain. However, in your Dissolving Pain book, you have a story about, and I can't remember if I get it right, it's either you went to the eye doctor or you went to the dentist, and the gentleman was crying. He said his mother had passed away, and it's the eye doctor, okay? And you were explaining to him how to dissolve grief. And you know, grief is on one level a taboo subject, still taboo. You know, people don't really talk about death and dying, and when they do, they tend to be a little bit uncomfortable. It's not something you grow up talking about. So can you briefly tell that story, how you showed this eye doctor how to dissolve his grief, and how it was just a simple exercise, but it was through the increase in awareness. And I know for me that when you have said to me, you know, well, Bob, continue to fully immerse yourself into the whatever experience that you're having, that I continue to be amazed at how that evolves and devolves and just spreads out.
Yes. Yes. Well, the story has been told. I came to the eye doctor for my own purposes, and I found the optician tearful, and I asked what the problem was, and he said his father just died, and he had a very strong emotional reaction to that, and he couldn't stop crying, and this was many weeks after the father had died, so it was really taking him over. And I just asked him to include an awareness of space around the feeling of grief, or whatever the feeling he was, sadness, whatever the feeling he was feeling, and to immerse himself in the feeling of grief and in the experience of space, until by the time I left, he had stopped crying, and he was not able to stop crying before that time. So it's a one-shot training session, basically, and it worked remarkably well in this case.
Well, I just, what occurred to me with this story, and why I keep bringing it up almost every time I see you, is that, can you explain to our audience, what is it about holding on tight or resisting? Yesterday in the training that you were doing, both you and Susan did exercises about what does this resistance refer to, or I forget the exact phrase that you used, but the point is that holding on to the resistance, rather than you say go into it and merge into it, and that dissolves it. Can you explain why that happens? What is it about the nervous system? And I imagine, you know, that it has to do with attention. So in your experience, in your clinical experience, why is that the case, that doing the opposite of the clenching, narrow focus, gripping, to use your words, why does doing the opposite dissipate and dissolve the pain, stress, or grief?
What created it in the first place was the holding. Otherwise, it would have been just a passing feeling or emotion that we all have. And we let go most of them. You know, go through, sometimes it takes longer than others, but we generally let most of them go through. But at some point we meet a feeling or an experience that we just can't control, we can't escape. And what we do is resist it, physically resist it. It's actually just as simple as that. Usually muscular tension is associated with it. And you hold on to the experience by gripping it, holding it, resisting the feeling of it. And all one needs to do is reverse this, is to open their focus and then open the focus that is related to the feeling under treatment and melt into that feeling and end up with a sense of well-being as opposed to painful legacy.
I just want to say what I think is so wonderful about the work that you've done, and it took 40 years to fully develop it, and it's all in the open focus brain. But the fact is that when we open up to space, brain waves slow down and become more rhythmic. More rhythmic, slow wave activity in the brain is a reflection of a nervous system that is in balance. If it's not in balance and you're in fight or flight, you have sympathetic over-arousal, which has all the experiences of pain and anxiety. As soon as you open up to space and brain waves slow down and get more rhythmic, and the nervous system now is producing relaxation when necessary and activation when necessary, all by opening up to space. And your work, which is so wonderful, it's not a belief system, it's not an idea. He was able to see on neurofeedback equipment, on brainwave equipment, that when you open up to space, these brain waves actually change. And these changed brain waves reflect a whole nervous system that's in balance. And the nervous system controls all the peripheral systems, the vascular system, which makes us cold and withdraws blood from the skin, the muscular system, which tenses up our muscles, and the endocrine system, which creates adrenaline and cortisol. So you have a simple effect: space, slower, more rhythmic brain waves, a balanced nervous system, and all the peripheral systems come online. It is that simple. And what Les has developed is this simple way to get there is space. You don't have to think about it. You don't have to worry about the content of your thoughts. You don't have to look at what happened when you were 5 years old. How simple.
Wonderful. That's great. Thank you, Susan. What I'm thinking is to explain to our audience why we are here. I just want to mention we are in West Palm Beach, Florida, not in your office in Princeton,
Yes.
New Jersey, where it's slightly chillier. So as we begin to wrap up, I want either or both of you to just talk about the workshop that you just did here, and then describe the services that you offer at the Princeton Biofeedback Center, and how people can contact you if they want to work with you or learn more.
We present 3-day workshops that 2 of the 3 days involve working on the biofeedback equipment, the neurofeedback equipment, so people learn how to open their focus and produce these slow rhythmic brainwaves. So the first 2 days are on the equipment. The 3rd day is the open focus practice itself. So people come away knowing how to change their brainwaves by attending an open focus, and have a chance to be on the equipment or even purchase it if they want to. At our clinic, we have a full service clinic. We provide neurofeedback and open focus training, and we treat every stress-related disorder, from anxiety and depression to physical pains of various kinds, attention deficit disorders. We do a lot of peak performance training, athletes and artists, performing artists, the whole gamut of a full-service clinic. And we can be reached through our website, openfocus.com, which has our phone number and our email addresses. And insurance often covers treatment. We do Skype sessions, and we do mini intensives where somebody can come for a period of time and get an intense training, or weekly sessions as any